Welcome to the FCICA Product Webinar Series. We are pleased to have Kevin Kennedy and Rich, I apologize, I need to look at your name. Rich, I'm sorry, I don't have your last name with me. Rich Lawson, with the Small Association Leadership Alliance to present about the FCICA Healthcare Program, thanks for the partnership with FALA. Gentlemen, the floor is yours.
Great. Thank you, Lizzie, and good morning, everyone. The presentation will take maybe 20 minutes or so today, so please feel free to send in any questions you might have. Some quick background on the program. In developing the program over the last couple of years, we had two main points we were trying to address. One was to have a national program, and two was to have a program that reduced costs in a meaningful way. In other words, we didn't want folks in FCICA and others to go through all this effort if we're only going to save people a nominal amount of money. But as you'll see, the program offers significant savings. The program itself is really an effort to simplify our ever-increasingly complex healthcare. It helps members meet the ACA regulations for preventive care and offers a great choice of affordable healthcare solutions. As you see on the bottom there, the average savings people are able to realize is right around 60%. That's when compared to what you would pay for healthcare on the exchanges. One last bullet here. Over the summer, we conducted a survey of participants in the program, and 91% said they were very or extremely satisfied with the program. So it really has been very well received. The program itself, though, is an alternative approach to traditional health insurance. And bringing the program together, we have two main partners. The first is Apex Management. And as I get towards the latter half of the presentation, I'll discuss the Apex plans. But there are two to choose from, the Advantage and Basic plan, and they really focus on preventive care. You would then pair that with a membership to Sedera Health. Sedera is medical cost sharing. I'll spend most of my time today talking about medical cost sharing, as it is a new option for folks to consider, or for many of us. But really through Apex and Sedera that we get to a comprehensive, cost-effective alternative to traditional plans and to traditional health insurance. The program and really our healthcare in general has three main components. There are large costs, which we refer to as needs, and these are the significant major medical events that we all have. It could be surgery or hospitalization or just some diagnostic imaging we're going through. Then there are small to medium costs, which is more run-of-the-mill type stuff, like cold, a sinus infection, or a flu. And then there's preventive care, which is everything from childhood immunizations and your annual physicals, colonoscopies and mammograms, and really everything in between. The program itself addresses all three of these components. I'll talk about each one individually. And I'm going to start with the large costs. And again, we refer to these as needs. And these are the significant medical events. It could be run your kid down to the ER for stitches or a cancer diagnosis and really everything in between. But with our program, these needs are addressed through Sedera. Now, Sedera is medical cost sharing. If you're not familiar with medical cost sharing, it originated back in the 1980s and has had a foothold with religious groups. Different churches or congregations would form an organization through which their members could participate and share in each other's expenses. Sedera is not a religious organization. They don't have any religious affiliation. Their parent company is actually called the CARES Group, and the CARES Group is a medical bill negotiating company, and they're the company that many of the religious organizations have turned to negotiate their larger bills. Well, when all of our healthcare costs really started to increase at just an unsustainable rate, the CARES Group formed Sedera. Again, Sedera is built upon the same best practices as the religious organizations, but doesn't have any religious affiliation. And Sedera's objectives are really all of our objectives. It's compliance and credibility. It's lowering our monthly expenses and also reducing our out-of-pocket costs. So at the end, when I talk about the cost of the program, you'll see that for everyone, it certainly offers a much lower monthly contribution. But then for most of us, it also offers reduced out-of-pocket costs. I'll go through all those details in just a few minutes. A couple of comments on medical cost sharing. Obviously, it's big savings over health insurance. It's healthcare through community again. It's not healthcare through insurance. As of the end of 2017, there are more than 1 million members sharing more than $1 billion annually. Sedera offers freedom from networks. And that's one thing that most folks key in on. I know I did when I signed up for the program a year and a half ago. So when you use your Sedera membership, you can go to any hospital you like or any doctor you like to get the care that you need. Sedera does not use a network. On the Apex side, they do use a network. They use a multi-plan network, and I'll talk about that in detail. But again, on the Sedera side, it offers freedom from networks. It can also be used overseas as well. Sharing begins at what's called your initial insurable amount, or IUA, and that's a term to get familiar with. I'll talk about that in just a few slides, but that's what you're agreeing to be financially responsible for if and when you have to use your Sedera membership. Here's a real quick graph that shows the adoption rate of medical cost sharing in recent years. You'll see that uptick really started around 2011, 2012, when we all started looking for an alternative to the ever-increasingly cost of healthcare. You'll see it has increased pretty dramatically since then. And really, the option that we're talking about today is medical cost sharing. It's the option that, like I said, more than 1 million people have turned to since then. In fact, it's closer to 1.4 million now in terms of people who are using medical cost sharing. So let's talk about how it works. And again, we refer to these medical events as a need. So what is a need? A need is one or more medical expense caused by a single accident or illness. So if you look at the illustration here on the left, this is someone who broke their leg, and there were costs obviously for the ride in the ambulance, the stay at the hospital, surgery, diagnostic imaging, prescriptions, and physical therapy. And all of these costs are wrapped up into that one need. Now, the member's responsibility is that IUA that they choose when they enroll. And as you can see, when you enroll, you have 5 levels to choose from. There's $500, $1,000, $1,500, $2,500, or $5,000. And again, that's what you're going to be financially responsible for. So if you choose the $1,000 IUA, for example, you're going to pay the first $1,000 of whatever the need is, or whatever the costs are for that need. So with the broken leg scenario here, if the total cost were, say, $10,000, and you had signed up for the $1,000 IUA membership, you'd be responsible for paying that first $1,000. Now, if you enroll as an individual, you're responsible for the first 3 needs in the calendar year. If you enroll as a family, you're responsible for the first 5. As a practical matter, we all hopefully have far fewer than that in a year, but if you did have a 4th as an individual or a 6 or more as a family, it would be at a $0 IUA. So when you look to calculate what your max out-of-pocket might be on the program, you would simply, if you enroll as an individual, it would be 3 times whatever the IUA is that you choose. If you enroll as a family, it would be 5 times that IUA that you choose. Here's a real quick, real-life example of medical cost sharing. This actually comes from the CEO of Sedera. Their family had a young child with a persistent ear infection. Prior to joining Sedera, they were, of course, on traditional insurance with a $5,000 deductible. Their child, after a series of antibiotics and booster injections, they went to an ENT who inserted tubes into the child's ears. On the left, you can see the out-of-pocket cost with traditional insurance was right around $2,500. And on the right, of course, if they had selected the $500 IUA, their cost would be just the $500. Now, the cost sharing works in really one of 2 ways. Obviously, if you have an emergency, like the broken leg scenario, for example, you go right to the hospital, get the care that you need, and whatever that is shareable. And the way that works is you're responsible for taking those bills and uploading them to Sedera. So when the hospital says to you, how are you going to pay or what's your insurance, you would simply tell them I'm a self-pay patient or a cash-pay patient and ask them to bill you. Your responsibility would be that IUA that you choose, but the balance would be shared through Sedera and paid accordingly. The second way in which this works is if you're having an elective surgery. In that case, Sedera may actually look to prepay for that surgery, or may also ask you to perhaps shop around a little bit and get the best deal for the community. But regardless, you would also identify yourself as a self-pay patient or a cash-pay patient, ask them to bill you, and you would upload those bills through Sedera, and they would be shared accordingly. On average, in terms of administering the plan, it does take people about another 5 or 6 hours per year just to administer the plan, but for a savings of 60% or more, it's really not too heavy of a lift. There are a few nuances to the plan. That's membership, medications, and pre-existing conditions. These next 3 slides are perhaps most important in determining if the program will work for you. Let's start first with medications. There are basically 2 types of medications we all take, those that are curative and those that are maintenance. The curative medicines are medicines that we take for a period of time until we're cured. So it could be antibiotics or pain meds or chemotherapy drugs or similar type medicines. The cost for the curative medicines are wrapped up into that IUA math, if you will, that we just explored with the broken leg, and would be shared through Sedera and paid accordingly. The other type of medicines many of us take are maintenance type medicines, and this could be for high blood pressure, high cholesterol. An overactive thyroid is a pretty common one. I take it for rheumatoid arthritis. But these are medicines we take daily or weekly or however they're prescribed. And the cost for the maintenance medicines are handled in one of 3 ways. That second bullet there with the Apex plan, probably 95% or more of the folks in the program who are on maintenance medicines get their prescriptions through to the Apex Advantage plan. And I'll talk about that prescription drug program in just a few minutes. That's how I get my prescriptions filled, for example. Other folks may want to look at programs like GoodRx or CleverRx or Liberty Benefits to get additional savings as well. But like I said, the majority of folks actually get their prescriptions filled on the maintenance prescriptions through the Apex plans. And I'll go through that in just about 5 or 10 minutes. Now, when members do sign up, they do have to commit to a few things. One is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices like diet and exercise can obviously improve one's quality of life, but it also keeps us all in the doctor's office and out of the hospital and keeps all of the costs low. Living a healthy and balanced lifestyle is obviously not legally binding, but it is something that members have to commit to try to do. Also, members have to commit to not use illegal narcotics and not to operate a vehicle while intoxicated. And so what does that mean? That means if you're driving a vehicle while intoxicated and you get into a car accident and you have medical bills, those bills could not be shared with the community. The principle here is that the community should not have to pay for someone's illegal activity. Also, tobacco users are certainly welcome to join. Everyone is, but there's a $75 surcharge per household for tobacco usage. In other words, if you have a husband and wife who both smoke, it's just one $75 surcharge per month, not one for each of them. Lastly, the fine print there on the bottom. For tobacco users over the age of 50, there is a $25,000 per need sharing limit for the top 4 diseases associated with tobacco usage, which is heart disease, stroke, COPD, and cancer. This next slide, I think, is actually the most important slide in the deck, if you will, and that is pre-existing conditions. This was the most important slide to me, or the most important guideline for me to make sure I understood before I signed up. Pre-existing conditions are defined as anything you've had a symptom of or received treatment for in the prior 36 months to joining. So when I signed up, I had to disclose I had rheumatoid arthritis. Now, if you have any of the top 4 listed there, high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, and assuming they all well controlled with medicine, there are no sharing restrictions. You have to disclose them, of course, but the restrictions that are listed below do not apply. So if you have anything else, and I'll use myself as an example with my rheumatoid arthritis, there are sharing restrictions. So what does that mean? Now, in the Apex component of the plan, going to see my rheumatologist is covered, my prescriptions are covered, my blood work is covered. But what this is saying is if I were to have a medical event, if I were to have a need, say I needed surgery as a result of my rheumatoid arthritis, that's when the restrictions would come into play. So if it happened in year 1, none of the costs for that surgery or that need could be shared. In year 2, up to $15,000 would be shareable. In year 3, up to $30,000 would be shareable. After that, the entire condition is fully shareable. So for myself with my condition, it's a chronic condition. There was nothing on the horizon, if you will, that would create a medical event or create a need for me. So for my joining was an easy decision. But let's say I had an active cancer, or say my wife was currently pregnant, now would not be the time for us to join because it would create a financial burden for me and my family, which is really exactly what we're all trying to avoid. So for those of us with pre-existing conditions, this is pretty critical for us all to understand. What we generally tell folks is that the program itself is a good option for probably 80% of the folks to consider, but it's not the answer for everyone. Depending on what your pre-existing condition is, this may not be a good option for you to consider at all. But if you have questions on it at all, please do reach out to us and we can talk to you one-on-one and explore what this may mean for you. But that's it for the large costs. Again, those are the significant medical events and the unexpected costs associated with them, for an accident or diagnostic imaging or cancer diagnosis or just an ER visit. But now I'm going to switch gears and talk about the small to medium costs. Included with everyone's membership is a subscription to Teladoc. Teladoc is the largest provider of telemedicine in the U.S. If you're not familiar with telemedicine, it's exactly what it sounds like. You connect with the doctor virtually over the phone or through your computer. And if you need a prescription or something like that, the doctor can send that to your local pharmacy. It's a money saver and a time saver. There's no additional cost for using Teladoc. And it's also a time saver, of course, because instead of having to run down to urgent care or going to your primary care physician to get the care that you need, you can oftentimes just connect virtually with the doctor to get that care. More than 75% of Fortune 500 companies now actually offer telemedicine for those very reasons. What people like most about telemedicine is it's great. Let's say you just need a Z-Pack for a cold, or we had a woman who had an eye infection and she did it with a video call with the doctor and he sent a prescription to her local pharmacy and she picked it up and it was cleared up a few days later. The other point that people really like about Teladoc is that if, let's say you need to talk to a doctor at 2 o'clock in the morning for whatever reason, you can talk to a doctor at 2 o'clock in the morning. So it's really doctor on demand. And it's really an outstanding service. Even their app on the App Store has nearly 5 stars and tens of thousands of reviews, so it's really just a great service. Also included SecondMD. SecondMD is a great way to get a second opinion on anything you're going through, medically speaking, of course, and some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins. SecondMD is here for 2 reasons. One, there was a study that showed that the average physician was 13 years behind on his or her continuing education. So SecondMD ensures that we have access to the most up-to-date information that's out there. And the second reason is that if you're having an elective surgery, Sedera does require you to get a second opinion, and you would do that through SecondMD. And again, it's done so virtually. It's not a heavy lift at all. And really, SecondMD has outstanding reviews as well. It really does. But that's it for the Sedera side of the program, if you will. Again, their focus is really on those large costs, those needs that we discussed. And it also offers ancillary services such as SecondMD and Teledoc. But now I'm going to talk about the Apex plan. Again, when you sign up, you actually first choose the Apex plan that best fits you and your family, and then pair it with the Sedera memberships that we just discussed. The Apex plans are really focused on preventive care, and there are 2 options to choose from. This first option is the basic option. It only offers coverage for preventive care. So it offers 100% coverage for the preventive care options that the Affordable Care Act mandated we all have. You'll see there's 21 for adults, 28 for women, 31 for children. If you recall, when the penalties were in place for health care coverage, they were focused on folks who did not have their preventive care coverage. While the penalties have gone away, the preventive care option or preventive care services that you see listed here are still covered 100%. This first option only covers preventive care. It does not cover prescriptions. It doesn't cover any ongoing care you might have. It's only preventive care, but it does allow you to set up a health savings account. And HSA is a great way, as you may or may not know, to put away tax-free dollars to be used down the road towards any future qualified medical expenses, such as dental, vision, doctor visits, and also to pay your Sedera IUA. Generally, about 25 to 30% of folks who enroll sign up for the basic option. They're people who are in good health, not on any prescriptions or not any meaningful prescriptions, if you will. They may be on a cholesterol med or a high blood pressure med. But there are folks who are in good health. They don't need any ongoing care. And the basic option is a great way to get into the program, get all your preventive care items covered, set up an HSA, and also select a Sedera IUA. The rest of us, myself included, are on the Advantage plan. The Advantage plan also covers all your preventive care 100%, just like the basic option, but then provides co-payments for ongoing care. So if you have to see your primary care physician outside of preventive care, it's a $20 copay. If you have to see a specialist like I do, from a rheumatologist, it's a $50 copay as well as blood work. The Advantage option also then offers prescription drug coverage. You'll see it's Tier 1 and 2 generics and Tier 3 preferred brand name. Those Tiers 1, 2, and 3 are generally where your maintenance prescriptions live. If you recall with the slide when I was discussing Sedera, there are 2 types of medicines we all take, curative and maintenance. The maintenance medicines are generally in Tiers 1, 2, and 3. Your curative medicines are generally in Tiers 4, 5, and 6. Just as a basis for comparison, the medicine I take for my rheumatoid arthritis is $13 if I do mail order and $27 or $28 if I go to CVS and pick it up. So it's actually right in line or a little cheaper than what I've always paid. Now, when I talked about Sedera, I made note that Sedera did not use a network. You can go to any hospital you like or any doctor you like to get the care that you need. On the Apex side, they do use a network. They use the Multiplan network. Multiplan is one of the largest networks in the U.S. There are more than 900,000 participating doctors in the network. And that's where, any doctors you see would have to be in that network. So when I signed up, I made sure that my primary care physician was in network and that my rheumatologist was in network, and they both were. So for folks that have any ongoing care, you need to make sure that the specialist is in the network. And then for folks who see their primary care physician or need to get a colonoscopy or mammogram or perhaps their children are due for their immunizations, those doctors would have to be in the network as well. Now, we can run a list of all doctors in network by zip code, so feel free to reach out to us at any time. We can run a complete list of doctors by zip code and get that out to you. But let's talk pricing and what everyone pays. The pricing is the same for all of us, regardless of your sex, regardless of where you live. We're all paying the same. This first slide obviously is for the Apex component. On the left there, you see member only, member and spouse, member and just the children, or member and the entire family, meaning spouse and children. That second column there is that basic option that only covers preventive care, but does allow you to set up a health savings account. You'll see the pricing starts at $71 and goes to $102. That third column is the Advantage plan. The Advantage plan, again, covers all your preventive care but it has the co-payment structure for any ongoing care that you may need, and then also offers prescription drug coverage. You'll see it starts at $144.59 and goes up from there. That red arrow there, that's actually the plan I'm on for $144.59 per month. So once you pick the Apex plan that best fits you and your family, you would then pick the Sedera IUA. Now, as you recall, there are 5 levels to choose from: 500, 1,000, 1,500, 2,500, and 5,000. For space reasons, we only have 2 listed here, but you'll notice that the higher the IUA, meaning the more you're willing to pay out of pocket, the lower your monthly contribution would be. On the left, you'll see MO is member only, MS is member and spouse, MC is member and just the children, and MF is member in the entire family, meaning spouse and children. You'll see, of course, on the top 2, it's banded across by age, those in their 20s, 30s, 40s, 50s, and 60s. And again, the red arrow is the plan I'm on for $175.51 per month. And again, for comparison reasons, if you look above, had I chosen the $1,000 IUA, my monthly contribution would be about $15 more per month at $190.81 per month. So again, the higher the IUA, meaning the more you're willing to pay out of pocket if you have to use your membership, the lower your monthly contribution would be. Here is actually the plan I'm on, and this will be the same pricing for anyone who's in their 40s and made the same selections I did. I'm on the Advantage plan because it does offer me the ongoing care that I need with my rheumatologist and the blood work that I have to get done. And then it also covers all my preventative care 100%. I chose the $1,500 IUA simply because it's kind of middle of the road. It's a comfortable, I'd be comfortable paying that amount if I want to have to use my membership. So my monthly total is $320 per month, and that would be the same total for everyone who makes the same selections. On the FCICA website, you'll find a wealth of information, including the current rate sheets, details on the Sedera and the Apex plans, as well as a great FAQ on telemedicine. A quick summary of the offering. It's available actually in 47 states. It's not currently available in Vermont, Washington, and Alaska, although it should be available in Washington and Alaska in the next couple of months. It does not need an employer sponsor, so individuals can join full-time, part-time, seasonal, hourly, or salaried staff. The monthly cost can be paid by the individual employee or by the employer. It can be set up either way. If you're an employer and you want to offer it to your staff as an option and pay for those costs and then offset it, of course, with a payroll deduction like you perhaps do now with traditional insurance, you certainly can. Or if you simply want to make this available to your staff to participate in the program and pay it as an individual, they can certainly do that as well. The one caveat, of course, is you have to be a member and a member in good standing with FCICA. As discussed at the beginning, the average savings we're seeing is right around 60% when compared to what folks would pay for health insurance on the exchange. And also, perhaps by the end of this month, but maybe not until 2020, the first quarter, there will be a dental option that people can add on at any time, as well as a vision option through VSP. And the enrollment process itself is actually pretty simple. You go through and you select the Apex plan that best fits you and your family. You then pick the Sedera membership that best fits you, and then you can add on additional coverages such as the dental option or vision. Also, let me put this next slide. Here's our contact information. If you do have questions, please do reach out to us. Email is best. It actually puts you into the queue, and we'll get back to you right away. So if you want to talk to us about any pre-existing conditions you might have and how they may impact your membership here, we can certainly do that with you. Also, a few dates to keep in mind. I know it's open enrollment season, and many folks are looking at healthcare options for next year. Our cutoff is the 18th. So if you want to enroll in the program, or if you have any staff members that do, and they want a January 1st start, they would have to enroll by December 18th. We have rolling enrollment, I should mention. So you can actually enroll in the program at any time during the year, and you can also leave at any time during the year. There's no long-term commitment. But if you want to enroll for say, an April 1 start, you would have to enroll by March 18th. So again, the 18th to enroll in the program or to leave the program is the date to keep in mind. But with that, if there are any questions, please do send them across, and we can certainly stay on the line and get all of your questions answered. But we certainly thank you all for joining us today. And please do hold on to those email addresses that you see on your screen and that 800 number, and reach out to us anytime. We can certainly set up a webinar to discuss the program with your employees. If that would work better for you, again, just let us know. We will make ourselves available.
Wonderful. Thank you so much, guys, for presenting on that program. It certainly sounds like a wonderful opportunity. Audience, if you would like to ask Kevin and Rich any questions about this, There is a Q&A tab on the left side of your screen. You can go ahead and click that, type in your question, send that over, and I can read it out to the gentleman to answer. You can also send your questions to those 2 emails that they've got right there, or give them a phone call.
Absolutely.
Come back later and have a question, you can email me that and I can send it along as well. So, Kevin, a question here for you. What if you want to set up a business to get employees enrolled in this? How would that happen?
There is a simple one-page form that we would send you to set it up. It has the demographic information, billing information, payment information, contact information. Once you have set that up, or once you have sent that in, it takes us around 24 hours to set it up, but you're then given a dedicated enrollment site that you and your employees and staff would use to enroll in the program. Obviously, that's not a link to be shared with folks because anyone who enrolls under that link would be charged to your account. But that is how it is set up. It's really quite easy to do. Like I said, the form is just a simple one-page form, and then you would be good to go.
Wonderful. Okay, from the audience, how would this program work if you're already receiving the tax-free insurance benefit through an employer?
So it sets up in a similar way. I think, I'm not sure what they mean by the tax-free. I think, well, let me tell you how it sets up. For the employer side, the entire expense can, of course, be written off as a business expense. If you're enrolling as an individual, the Apex portion is tax-free, and 9.9% of the Sedera portion is tax-free for the administrative burden. The balance of the Sedera cost is post-tax, and the reason it's post-tax is so that when your need is funded, that ensures that it does not become a taxable item to you. For the employee, it would set up the same way it does now, and then offset with any sort of payroll deduction they currently have in place. So it should be relatively transparent to the employee, depending on what the payroll deduction is, of course. Hopefully that answers Chad. If not, Chad, send us a note and we can hop on the phone and talk about it a bit more.
Okay. It looks like he says thank you, so hopefully that did answer his question. Okay. Can you explain prescriptions in a bit more detail?
Sure. So there are really a couple options there. One is to sign up for the Apex Advantage plan. And depending on your prescription, it was for me at least, that made the most sense for me financially. But for folks, like I alluded to in the presentation, if you have kind of a more simple prescription, a less expensive prescription, say it's for cholesterol or high blood pressure, you can use a third party like GoodRx or CleverRx, generally get those prescriptions for less than $20. And so at that point, it may actually make more sense for you to go with the basic plan financially and take advantage of the health savings account. So you have a choice there on how you want to handle it. Myself, with my condition, I have to see my rheumatologist a few times a year. I have to get blood work done. My prescription is a little bit more expensive. So the Advantage plan made the most sense. If I had a more basic prescription or more basic need, if you will, I would have been on the basic plan and taken advantage of the health savings account and just use a third party like GoodRx or CleverRx. So GoodRx and CleverRx, you can go out to their websites and find out the price for your prescription. It's free to do, of course, and then figure out the math and what makes the most sense for you financially. Taking advantage of that health savings account with the basic option is a nice benefit if it fits your medical needs.
Okay.
Anything else, Lizzie?
For Teladoc, can you explain their services a little more and how to access them?
Yeah, so Teladoc, you can access it through your phone or through your computer. You can do an audio call or you can do a video call. It's just an outstanding service. It's free to use. So once you are enrolled in the program, once your start date has begun, you simply register with Teladoc, and we send you directions on how to do that. And I would also encourage you to download the app on your phone. But it's a great service. It's 24/7, 365. And again, it can be a video call or an audio call. There's no cost for using the service. Excuse me. And the doctors through Teladoc can also prescribe prescriptions. So like I said, if you need a simple prescription for a cold or an eye infection, ear infection, things the basic type things, Teledoc's a great service to use, and they simply send the prescription to your local pharmacy, and you pick it up. Anything else?
I'm not seeing anything else coming through from the audience right now, and I think we've covered most of the common questions about the program. So I think at this time we can wrap up. I apologize for my dog.
That's okay. That's okay. Well, we certainly appreciate everyone's time, and thanks again to FCICA for putting this together. If you all have any other questions, please do reach out to us, and we'll get them answered for you. Or if you want to talk one-on-one, just let us know as well.
Cool. Thank you so much, Rich and Kevin, for joining us today. And again, if any questions come up later and you don't remember how to get in touch with them, you can always send them over to FCICA and we can help you out as well, or send your questions along to get answered. If there are any SIMs on the line, you can go ahead and go over to the Submit Credit tab on the left side of your screen. You'll be asked to submit a feedback survey, and then you can receive your credit. And if you have any questions on that, go ahead and reach out to me. I'm here to help all of my SIMs. Okay, at this time, I'm going to wrap this up. Have a fantastic rest of your day, and hopefully we'll see you next week for our next webinar.